We continue with our focus on cluster headaches. Last evening, we told you of the story of one gentleman living with the condition and who is making a call for greater public awareness. Tonight, we sought to bring you a medical perspective from a neurologist. Marie Hull tells us more.
Neurologist Dr. Azad Isak describes cluster headaches as a peculiar type of headache, which primarily affects men between the ages 30 and 50. He says the severe pains experienced during a cluster makes it easy to diagnose.
But this is a very important, peculiar kind of headache syndrome that's not very difficult to diagnose or to recognize and ought not to be missed, because it's such a severe headache syndrome, and the patients get much better very quickly with treatment.
Dr. Isak says in Trinidad and Tobago the condition is relatively common, and a neurologist may treat at least 3 patients living with the condition each month. However, he says once a patient is properly diagnosed, treatment in the form of medication is recommended.
It's a great headache to recognize because it's highly treatable, and you can treat it with things like steroids and a drug called verapamil, and it's really very effective. In very severe cases, you may want to use oxygen as well.
He notes the treatment of headaches on the whole may pose a challenge because of the overuse of drugs, which weakens the body's resistance.
They've been taking analgesia or painkillers all the time, yes? And then what happens is they become addicted to the painkillers and can't do without the painkillers. So when they don't have the painkillers, they get what we call rebound headache, and that headache can be quite severe. And what they then do, they take more painkillers and they have more rebound headache, and that can go on for a number of years.
The term cluster headaches was originally used to describe the clustering or sequencing of painful attacks that occur for weeks to months at a time and then spontaneously terminate. Marie Hall, CNews.